Welcome to Robert Wood Johnson University Hospital Somerset's Health Talk. I'm Dr. Douglas Ashinsky of Robert Wood Johnson Physician Enterprises, Warren Internal Medicine. Having a baby is one of life's most special moments. Preparing for a healthy baby takes 9 months and more. On today's show, we will get tips for a healthy pregnancy, starting before conception through each trimester. We are joined by Dr. Amanda Francis, an obstetrician gynecologist with RWJ Physician Enterprises, Roseland, OBGYN. Welcome to the show.
Thank you.
Dr. Francis, first let the audience know a little bit about you, about your education, and if you're married and have kids yourself.
Okay. So I graduated from medical school. I'm a DO, a doctor of osteopathy, from the New York Institute of Technology, School of Osteopathic Medicine in 2012. I did my residency at Morristown Medical Center in obstetrics and gynecology. I graduated in 2016, and prior to coming to Roseland, I was at Rutgers, Robert Wood Johnson Medical School, where I was in the general division of OBGYN, and I was in the Rutgers Medical Group.
Well, congratulations.
Thank you.
First of all, just so people know, DO and MD basically are the same thing.
Right.
There is no difference between the two. You are still a physician.
Correct. And I actually did what's called an allopathic residency, and we actually have a little additional training in osteopathic manipulative therapies.
Okay, so let's start with a woman thinking about becoming pregnant.
Right.
A woman thinking about becoming pregnant, there has to be something she should start to think about. What should she be thinking about with her significant other?
Right. So any woman considering pregnancy should be taking prenatal vitamins. There's a lot of different types out there. Some contain folate, some contain DHEA, some contain iron, but the most important component is folate or folic acid. We want any woman considering pregnancy to take prenatal vitamins containing at least 400 micrograms of folic acid. And this should really be a time that they should be wanting to optimize their health. So if you haven't been someone that's been active, this is a good time to get into an exercise program. Nothing crazy, just start, 20 minutes a day, at least 3 times a week, increasing your heart rate. Walking is a great way to start, stretching also. Diet is very important. We want to, if you're not someone who has been that much thinking about their diet, this is a great time to start adding those healthy components like seasonal vegetables. Leafy green vegetables are always great. Fruits. If you eat meat, lean meats, fish is a great component, a great source of those omega-3 fatty acids that are helpful for breastfeeding and in addition to pregnancy. Also, those healthcare maintenance visits. So not just going to see your OBGYN when you get pregnant, but making sure that you've seen them prior to address any issues in your health. As OBs, we may have an emphasis on reproductive health care, but we address the entire spectrum to help with our other partners and our other specialties to make sure that everything's on track. So dental visits are also super important.
So again, a woman and their significant others thinking about becoming pregnant.
Mm-hmm.
Number one is that they have to first, it would be nice if they saw their general practitioner, internist, family practice, and got themselves just a regular routine exam, checked that their blood pressure was fine, their EKG was fine, their blood work itself was fine. Mm-hmm. They start discussing with the general practitioner, internal medicine person, family practice that they're considering getting pregnant. Mm-hmm. At that same time, they should hopefully be also talking to their OBGYN, getting into there to be seen so that they can have their pre-visit, ensuring that everything is fine, and at the same time, starting on some type of prenatal vitamins, which contain folic acid to reduce the possibility of neural tube defects during pregnancy. Right. And this way also just to check that the anatomy and everything is fine, go through a full OB history, including the parents' history so that they know if there's any concerns or any problems itself. Right.
Most women are going to come typically after they've become pregnant in the very beginning, but if you are lucky enough to have a preconception visit, this is also a good time to do carrier screening. So we have genetic counseling that's available to all of our patients, but anyone who has a family history of anything, there's certain testing that can be done on the parents to not necessarily discuss what to be done with a pregnancy, but more how to manage. Is there types of therapies that need to be discussed? Is there, all the different options information is power.
And again, since you are part of Robert Wood Johnson Somerset Hospital, we do have very good genetic counselors on staff who are available to go through anything or any possibilities and to give good advice on that. So you, in cooperation with the genetic counselor, can give the best advice possible. The woman now is successful, which unfortunately is not always successful, and there are some people who need longer periods of time to become pregnant, or other modalities to become pregnant.
I think that's a great way to segue into women getting pregnant later in life. As we know, it's becoming increasingly more common for women over 35 and older to delay their pregnancies until that point. It's very common for them to have healthy babies, but it's important for them to understand that there are increased risk factors. Any woman is at risk for medical conditions in pregnancy, but as we get older, women 35 and older are increased risk for specific conditions like twins. You're more likely to have twins or multiple pregnancies as you get older. You're more increased risk for an ectopic pregnancy. An ectopic pregnancy is a pregnancy anywhere outside the uterus which is not able to continue on to a healthy pregnancy. It needs to be treated, and there's a variety of ways we can do that. Chromosomal abnormalities are more common in pregnancies in women 35 and older, which can mean a lot of things. It can be harder to get pregnant, meaning take longer, or you'll be more likely to have a miscarriage. It's also possible to have something, what I think most people think of as Down syndrome. It's called trisomy 21, one of the more common chromosomal abnormalities. It's also an increased risk for stillbirth as women become older. And this is not at all to scare women who are 35 years and older interested in getting pregnant or who are already pregnant. It's, again, from the very beginning of prenatal care, we look at all the risks that a woman has, and we are looking for a plan to manage them. And we have a lot of interventions that are very effective. Something else that becomes more common as women get older is gestational diabetes and hypertension. So again, not to scare women, but we make up a plan from the very first visit, which is another reason why prenatal care at the very beginning of pregnancy, as soon as you find out, is very important.
And again, it's that life has changed. Our parents got married at 18 to 20 years of age, and they had kids in their 20s. We now have a different type of lifestyle. Women are going to college, graduating,
medical school,
going into medical school, doing other type of things where the pregnancy is not going to, they're not going to get married until later on in life. They're not going to have the pregnancy later on in life. They still have a much better risk of having a normal pregnancy than an abnormal pregnancy. They just need to know the risk factors so that they can be prepared. God forbid something is there, that they can take care of it and that they have the knowledge in order to do it.
Right, exactly. Prenatal care is not just for all this testing. We do want to start it as early as possible so we can, the interventions that we have are specifically timed, so the sooner we find them, the sooner we can make the interventions, the more effective they are. But prenatal care is also support. Your body is going through a tremendous amount of change, and there's changes that you have to make to your lifestyle to have not only be a healthy mom, but have a healthy pregnancy. So it's really important for an OBGYN to develop that relationship early on so that you can be a touchstone as an OB for my patients to discuss changes that we're making to your lifestyle and discuss the changes that your body is undergoing so that, we can, navigate pregnancy with the least amount of anxiety as possible.
So if she gets pregnant, she comes to you, and you now go through the whole prenatal type of care. You ensure that they are taking their prenatal vitamins. Hopefully they were started beforehand, but if not, you'll start them during that time. You'll make sure they follow a good exercise program, keep on a good diet, and at the same time, you'll do the blood or urine screen to ensure that the pregnancy is there, and you can also give them possible due dates. Right,
so that's the best part of the first trimester visit. We come in, and this is typically the first 14 weeks. Between 11 and 14 weeks, we do the first ultrasound. Sometimes it's the first time to see that and hear the baby's heartbeat, and we measure the pregnancy. We're also looking for, like we mentioned before, neural tube defects, or basically abnormalities in how the brain and the spinal cord are developing. But it's a chance to make sure that the pregnancy is growing appropriately, and like you said, we can give the due date.
And I can tell you from when we had kids, the ultrasound was basically a little picture with little dots and stuff on it. Nowadays, with the 3D ultrasounds, it really is a very, very different ultrasound than we had.
Yeah, that is definitely the second trimester ultrasound, which I think people a lot of times associate as the gender ultrasound. While that's super exciting, The most important part of that is to survey all the baby's anatomy and make sure everything is there and is growing appropriately for the gestational age. It's also the first time we're going to get an estimate of how the baby's growing. So and we have percentiles, again, that are consistent with gestational age, and as long as that's normal, those may be the only 2 ultrasounds that you get. I have a lot of patients that talk about, oh, I thought I was going to get an ultrasound every time. That's not necessarily necessary for a healthy growing pregnancy, a healthy mom, no medical conditions. Those 2 ultrasounds that you get are really all you need. There's plenty of imaging centers out there that'll do 3D and 4D. I'm not necessarily sure what the 4th dimension is, but ultrasounds just for entertainment purposes, I guess they would describe them as. But the second trimester ultrasound is really, like I said, survey of the fetal anatomy and the first time that we can see how the baby's growing.
Now, during the first trimester, it's not only the visit, but it's also the importance is the continued care, because the woman herself may not be feeling well during that first trimester. Right. So she needs a good OBGYN who's able to contact her, also part of a system, so that in case she is having nausea, vomiting, inability to keep food down, becoming dehydrated, that there's ways to avoid things like that.
There's definitely a lot of home remedies that we start by recommending, but even the first-line medical interventions are actually vitamins. Vitamin B6 is a very effective way to treat nausea and vomiting in pregnancy, which unfortunately is very common in the first trimester. Typically, it will be self-limiting to around 17 weeks, but every woman's different. Some women have nausea throughout their pregnancy. Some women have to get to the point where they have to be on other medications, antiemetics, or some medications that stop vomiting. But again, the best way to decide what treatment is going to be the best is to talk about it with your OBGYN.
So it's important to have that open conversation with her. It's important that the OBGYN be available for those times. Right. So it's important to be, with an OBGYN who is someone that you can trust. Right.
In the very beginning, we have visits a little more spaced out, but that's just a baseline. We can always tailor it to you. If you're someone, especially who's having a lot of nausea and vomiting, we want to make sure that you're gaining weight appropriately or that you're not going down in weight. There's really we have recommendations as far as how much weight to gain, really more to help patients have a target in mind, but we're really more concerned about the extremes. People going underweight, losing weight, and conditions like nausea and vomiting in pregnancy, like you were mentioning, or something called hyperemesis gravidarum, which is a much more serious condition where weight is lost, which is something we want to avoid in pregnancy, or the other extreme where the BMI or the body mass index is very high. Either of those can translate into conditions that that have adverse outcomes for the pregnancy.
So during the second trimester, the important thing you said was the ultrasound to check or that everything is looks appropriate or doing appropriately, and of course the seeing whether or not it's a boy or a girl.
Right.
And during that time also it's important to continue a good diet and exercise program. Also, women should not suddenly stop their exercise.
Completely. We want women to keep moving. If you're someone who's never exercised a day in their life, don't start CrossFit. This is the time to start walking. Just start stretching in the mornings, or when you come home from work. If you're someone who already has a regular exercise routine that's not as regular, make it more of a regular part of your life. If you're someone who has a very rigorous exercise routine, like you're already doing CrossFit, we're not saying park yourself on the couch. We want you to modify your activity according to how you feel. So for someone who's a runner, someone who's done New York City marathons or maybe the Boston Marathon, you don't want to stop running. You want to keep your running so that you feel like you can carry on a conversation. And for people who are trained runners, that's very easy to do. Again, we don't want you to change your life. The whole concept of confinement in pregnancy, that's a very dated term. And I think that even though we don't use it, it's still the mindset that is carried a lot with when they think about pregnancy. We want you to keep your life the way that it's been, especially if you're someone who's very healthy. We want to modify it so that you can continue and have a healthy pregnancy.
So again, we want to modify. We don't want to stop.
Exactly.
We want them to continue to do a healthy diet, continue to exercise, possibly modifying the exercise based on how they feel.
Right.
But if we want to continue a good active pregnancy, we want them to continue to follow good healthy eating habits, good healthy diet, good healthy exercise program.
Right.
And that may keep them a smile on their face during the time that
it definitely helps with all the changes. There's so many things taking place. If you're someone who has a regular routine, we want to do everything to help you keep that, because that consistency is definitely going to help mitigate anxiety, which doesn't get as much play as the postpartum depression. Postpartum anxiety or even peripartum anxiety during the pregnancy is very common. And again, you're going through a lot of change. It's to be expected. Another important part of the second trimester I want to jump on is this is the time when the baby starts moving. So 17 to 20 weeks is when you start to feel fetal movement. Some women can take up to 22, 24 weeks, depending on the location of the placenta, but definitely should be feeling regular fetal movements by the end of the second trimester. And if that decreases, that's something we need to know about.
So again, if they've been having movement in they've been feeling it and suddenly they don't feel it anymore, that's the time to call the OBGYN.
Definitely, and we are available 24/7. At Somerset, there's always somebody on call, even in addition to your personal OBGYN, which hopefully will be me. But that's definitely something we want to know about.
And the other thing is, since you are part of Robert Wood Johnson University Hospital Somerset, we also have at Robert Wood Johnson University Hospital Somerset a level 2 NICU,
Correct.
24 hours a day, neonatologist, anesthesiologist. So in case you do have to be hospitalized, you are being given the best possible care, since we are so specialized and able to take care of you.
Correct. And a level 2 NICU means that babies over the age of 32 weeks gestational age will be able to stay in that hospital. Even if for some reason there were to be a preterm delivery, we'd still deliver at Somerset. Again, the same neonatologists that work at Robert Wood Johnson in New Brunswick at the level 3 NICU are at our hospital, so they would transfer the baby outward. But for most women, that's not going to be an issue.
And since we do have the ability of telehealth at the same time, people from down in New Brunswick would be able to communicate up to Somerset anything that's necessary, and if the transfer is necessary, it would be a much easier transfer, since everyone would know everything that was done up at Somerset down in New Brunswick also.
And also a lot of times the same exact people, so yeah.
So now we go to the third trimester.
Yeah. So third trimester is typically 28 weeks to 41 weeks. I know we hear 9 months and everyone's like 36 weeks. That's actually still preterm. But so 40 weeks hopefully is the end. That's the due date. But this is the time when the body starts preparing for delivery. So this is a really great time to talk about a birth plan with your OBGYN. Birth plans have a variety of presentations or manifestations. I think there's the more complicated side, and there's also the more simple side. I like to start more simply. If you have specific needs, that's something to talk about in the very beginning, and as you get closer, to modify it. But birth plans should include, what's your plan for pain management? What's your plan for once the baby's born? Who's going to be in the room with you? How many people are you interested in having in the room with you? Things like that. The internet is a great resource for these types of examples as far as birth plans. But I think it's best to start out simple, and if you want to add things, great. And if you don't, then you always have the very basics. Like I said, I think the first and most important thing really is pain management, and where does the baby go after? Do you want the baby do you want to do skin to skin right away? Some people are rather the baby be seen by the nurse, evaluated, cleaned, make sure that everything's okay. Do the footprints. That's a really great keepsake for a lot of moms, that the little take-home birth certificate with the baby's footprints on there. Get all that stuff together, and then skin to skin, which we can do. That's a standard for all of our moms at Robert Wood Johnson Somerset.
And again, all of this done at a place that has the level 2 NICU. So in case something does happen or something is discovered, we can still ensure that they're taken care of as best as possible.
Right.
And during this third trimester, the woman's body really will be changing immensely.
Right.
She may have to, again, start modifying her exercise. She may have to start to notice that she's not able to do what she couldn't do. She may have to start modifying her schedule at work also.
Right, work. That's a great topic. Disability. Most women I shouldn't say most, every woman has the option of going out at their due date. A lot of women want to go before. Whether or not you can, whether or not your work will allow that 4 weeks prior, 36 weeks. Will depend on your job, but the best time to start to think about those types of things, what type of disability does your employment offer? When do you think you want to go out of work? Are you already thinking about, not being in work? Is the third trimester. We're going to be doing our visits a lot more frequently in the third trimester because we're looking for signs of labor. We're looking for those modifications in your activity. We're looking for those telltale signs that things are really happening and you feel like, you're getting close to that time. The other test I feel like a lot of women ask me about is GBS, or group beta strep. That's a basic test that we do in the third trimester to check for a very common bacteria that is present within about 20 to 30% of the population. Doesn't mean that you're dirty or that you're sick. It's just a bacteria that is one of the most common causes of neonatal sepsis. If you have it and you're going to go into labor, then we provide you with antibiotics prophylactically in labor. And even if you're someone who's not going to labor, if you've had a C-section before, you're interested in having a C-section, the NICU likes to know what the baby's status is just in case he or she gets sick.
And during that time, we're also going to check for gestational diabetes.
Right, gestational diabetes actually in the second trimester, but that's a great point to bring up. Gestational diabetes, as we talked about, is more common as women get older, but any woman can get gestational diabetes, so we screen everyone in the second trimester, starting at 24 weeks.
And the screening is?
The screening is a sugary drink. I've had it myself. They have different flavors. It tastes like, the one I had was lemon lime, and it tastes like a flat Sprite. They give you about half of a soda's worth to drink, and you have to stay in the lab. You don't have to fast prior, which I think is important because a lot of women mix that up. You drink it, and then they take your blood an hour later, exactly, and you have to stay in the lab an hour, so that you need that time. But as long as it's normal, then you don't have to do anything else. If it is abnormal, then that requires another confirmatory test where you do have to fast, but we can always talk about that later.
And again, the reason for that is since they are having gestational diabetes, we are concerned about the growth of the baby itself.
Right. There's a lot of things that can go with gestational diabetes. I think one of the main things we think about is the growth, but I think importantly to discern is disproportionate growth. So in fetuses of gestational diabetics, they're more likely to have a larger abdomen in comparison to the head. So that translates into the risk of possible shoulder dystocia, the baby getting stuck coming out. There's no way to predict, and this happens with even normal-sized babies or babies that are not from moms that are gestational diabetics, but it's an important risk factor to identify. There's other things with gestational diabetes. We want a very tight control of how your blood sugar is looking during pregnancy, because that decreases the risk of possible stillbirth, these other growth abnormalities that we talked about.
And again, what it is that first the line of treatment is going to be diet.
Right.
It's going to be doing finger stick sugars on yourself to check.
Sticking your finger, writing the values down, or keeping them in your meter and bringing those values to the doctor, to our office, so that I can look at them and make sure that they're in that tight range that we talked about. Most women, like you said, are able to obtain control with diet, but if medications are needed, again, there's a reason why we're recommending medication. We want to keep you healthy, we want to keep the baby healthy. Uncontrolled sugars and gestational diabetes also increase the likelihood of you becoming a diabetic or a type 2 diabetic after pregnancy. So all things to help.
So with all of this going on, what should they consider when they're thinking about having a baby?
So I think finding an OBGYN that is covered by your insurance that you like is the most important thing. I think nowadays insurance does play a huge part in who we choose, but there's still going to be a lot of options, and I think finding your doctor first is the most important thing, and then finding out where they deliver. So if the hospital that they deliver at is somewhere that's not necessarily the closest hospital to you, it's very important to make sure that that hospital that is closer, even if you choose not to deliver there, is a place that has an OBGYN on call. If not, you need to make sure that you always go to the hospital where your doctor has privileges. That's ideal, but I think in my experience, there's a lot of hospitals now, a lot of our smaller satellite hospitals that don't necessarily have an OBGYN on call all the time, and I think it's important to know what the services are for the hospitals in your area. But at Robert Wood Johnson Somerset, we always have a board-certified OBGYN on call, so in-house.
again, so important that people who are living in this area, that you have this community-based hospital that has an OBGYN always on call, that has in the hospital, that has a level 2 NICU, that has 24-hour a day, 7 days a week neonatologist, 24 hours a day, 7 days a week anesthesiologist, and has state-of-the-art equipment that you think about delivering in a hospital like that, and therefore picking an OBGYN who does do their deliveries out of a hospital that has this type of program.
Right. The last thing I think you want to have to think about is being transferred to another hospital while you're waiting to deliver or you are just newly delivered. I think that's an additional stress. If you can avoid, that would be great.
And then the other thing, of course, is looking at the OBGYN suite where you're going to deliver.
Right, of course. The postpartum suites at Somerset are very nice. The staff is very knowledgeable, very helpful. In addition to, as you mentioned, the neonatologist and the anesthesiologist, we also have lactational consultants. We, of course, encourage breastfeeding, and I think a lot of women are really interested and motivated these days. So we have lactational consultants on staff to help with any questions or concerns you have about that.
Which, again, is extremely important, especially for the first-time mom who is so... She's thrilled about the baby, but has no idea that the baby doesn't come with instructions, and that needs some type of help.
Right, and breastfeeding is a great thing, and it does require a lot of work, and I think a lactational consultant is someone that you want to become familiar with in the very first few days, hours of pregnancy, of delivering, because that is a relationship that you may rely on throughout your postpartum period. So the best connection you can make is in that first 24 hours, which we, again, have access to.
Well, thank you very much for being here. Thank you for giving our audience all this knowledge that you have. Thank you for everything that you bring to the table with you, as well as to Robert Wood Johnson University Hospital, Somerset. This concludes today's episode of Robert Wood Johnson University Hospital, Somerset's Health Talk. Please remember that the opinions expressed here by a medical expert are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral line at 888-724-7123. Download the RWJBarnabas Health Connect app to schedule doctor appointments online and manage your health records right from your phone or tablet. For more information about Robert Wood Johnson University Hospital, Somerset, please visit our website at www.rwjbh.org/Somerset. Thank you very much for being here.